Cannabinoid-assisted psychotherapy for PTSD, diagnosing post-traumatic stress disorder, understanding the endocannabinoid system in PTSD, overview of psychedelic-assisted psychotherapy, implementing cannabinoid-assisted therapy as a treatment for PTSD, and dosing cannabis for psycholytic therapy. Medical doctor at Reconcious Medical from the United States of America, Dr. Mark Braunstein.
Hello, I'm Dr. Mark Braunstein, and today I'm going to talk about cannabis-assisted psychotherapy for PTSD. I'm the founder and CEO of Reconcious Medical, a public benefit corporation. Cannabis has continued to evolve alongside humans for centuries. Therefore, cannabis today is very different than that of previous decades and previous centuries. It is much more potent as well as more therapeutic. Advances in cultivation technology and increasing amounts of data on cannabis effects have set the stage for a new frontier of customized plant medicine. One such frontier is cannabinoid-assisted psychotherapy. This is a little bit about myself. I've been a psychiatrist for about 22 years, and I don't prescribe psychiatric drugs anymore. I strictly use plant medicine to help my patients. So I use plant medicine, wilderness therapy, psychotherapy, exercise diet, and spirituality, really focusing on the wellness of the patient overall instead of simply giving the patient medications to feel better. And currently I'm involved with my project at Reconcious Medical, where we are doing cannabis-assisted psychotherapy as well as ketamine-assisted psychotherapy for a wide variety of mental illnesses. Today, we're going to primarily talk about cannabis for PTSD. Okay. So let's talk about PTSD. It's very common. It occurs in about 10% of the world's population. And while we don't have the data yet, we know with COVID-19, rates of PTSD will go up. People who have spent months in isolation, weeks in critical care, and people grieving for the loss of loved ones. So we expect to see a surge in PTSD. PTSD was first introduced as a psychiatric disorder in 1980. It's shifted throughout the years, and now it is in its own category because it includes symptoms from a wide array of mental illness, including bipolar, ADHD, and anxiety, as well as psychotic disorders, mood disorders, and impulse control disorders. So PTSD can kind of be the great imitator. It can look like a lot of other mental illnesses, and we have to be careful that we don't lump it into and treat it as such. Let's go over the diagnosis. How do you make the diagnosis of PTSD? First, you have to have a stressor, obviously. You want to look out for intrusive symptoms, including nightmares, flashbacks. You also must have avoidance, where you avoid things that trigger memories of the event. You also have to have negative alterations in mood or cognition, such as memory disturbance, forgetfulness, losing time. And then you also have to have alterations in arousal and reactivity, such as being very jumpy, being very on high alert all the time. So those are the main categories that you have to go through to make this diagnosis. When we look at the drugs currently recommended for PTSD, we look at what's approved, which is just a few SSRIs and an SNRI. However, when you look at the drugs currently used in combination to treat PTSD, It includes mood stabilizers, antipsychotics, stimulants, antidepressants, anti-anxiety agents, antihypertensive agents, really medications from across the board in psychiatry we're using for PTSD. And I think patients want an alternative. I see patients every day who are tired of this. They're tired of taking drugs in combinations, having side effects, and they want something different. And that's where cannabis can step in. Cannabis can be thought of as first-line treatment for some of these mental disorders. We don't need to start with the antidepressants or SSRIs. We can go right to cannabis. Lack of side effects, efficacy, tolerability. We just have to be intelligent about how we dose, and I'll talk more of that in a minute. And again, cannabis PTSD being very prevalent. And then if you look at people with PTSD, a study showed that 65% of people in the US with PTSD use cannabis. So if you think about that, why are they using cannabis? With substances, I always try to think of what people are using and what it can actually be treating. Because I think people can often think about cannabis as they use it recreationally, but oftentimes it's medical. So if we look at PTSD and think about why cannabis for patients with PTSD, let's look at the endocannabinoid system in PTSD. The endocannabinoid system, the ECS, gets tweaked by PTSD. There was a really good study done in America after the 9/11 terrorist bombings, showing that the people who had PTSD had alterations in their endocannabinoid systems after this event. However, the control group that did not get PTSD had normal levels of anandamide in their bodies. Anandamide is a naturally occurring in the body cannabinoid. Let's look at PTSD and endocannabinoid system deficits. Specifically, low levels of anandamide skews CB1 and CB2 receptor activity. A dysfunctional endocannabinoid system induced by stress and trauma can cause a lot of problems in the body, such as increased cortisol, insulin resistance, hyperactivity of neurogenetic functioning, causing high blood pressure, dysregulation of the hypopituitary, adrenal axis functions, and hyperarousal of locus coeruleus, causing that hyperstimulation. So a lot of organic deficits occur in the body because of PTSD as it relates to the endocannabinoid system. If you look at the endocannabinoid system and stress response, on a normal level, the endocannabinoid system is helpful with mitigating excitotoxic reactions from anxiety. However, when you have more stress come on, the endocannabinoid system is not able to function as well, and that stress can overtake the ECS function, creating excitotoxicity and harmful effects on the body. If we look at how how taking cannabis can play into this, we see how if we can bond to CB1 and CB2 receptors, then we're more likely to bring up the body's natural levels of cannabinoids, mitigating the negative effects of PTSD on the body. And then in clinical practice, how do we actually prescribe cannabis for PTSD? I do it two different ways. One way is through symptom relief with cannabis, and another is with cannabis-assisted psychotherapy. So let's look at cannabis for psycholytic therapy first. So that's when we talk about cannabis-assisted psychotherapy. So CB1 receptors are located in the parts of the brain responsible for processing fear, stress, emotions, and reward. When these are activated, unlearning of negative associations is facilitated, making psycholytic therapy more effective. So what that means is when you take a certain amount of cannabis, it creates a response in the brain so that you're able to unlearn negative associations, making new ones. That's the process of cannabis-assisted psychotherapy. using cannabis to create new brain pathways with psychotherapy. We can use it besides in PTSD, also depression, chronic pain, bipolar, fibromyalgia, social and generalized anxiety, as well as autism. Very few contraindications, the main one being a psychotic disorder. When we look at dosing taken from existing studies, THC dosing ranges seem to be about 0.1 to 0.2 milligrams per kilogram a day. And CBD dosage seemed to be around 1 milligram per kilogram per day in divided dosages. What was reassuring to me about this is that it really lined up with my protocols. When we talk about medical cannabis for psycholytic therapy, here's the dosing that I use. In someone who's very sensitive to cannabis, such as someone who's never used cannabis before and may have experienced a hypersensitivity reaction, we're going to use a very small amount of THC, about 0.25 milligrams in an oral dose. In a mild cannabis user, such as someone who uses less than 5 milligrams at a time of THC, or can have 1 to 2 hits of cannabis flower, we're going to use 5 milligrams of THC on an oral dose. For a moderate cannabis user, someone who maybe can have 5 hits of cannabis at a time, they're going to have 10 milligrams will be their effective dose. And for a heavy cannabis user, we're going to use 25 milligrams. I'd say a heavy cannabis user is someone who will use between 25 and 50 milligrams of edibles or can smoke an entire cannabis cigarette at a time. When we think about therapeutic modalities with cannabis-assisted psychotherapy, we can use multiple modalities: cognitive behavioral, dialectic behavioral, psychodynamic, art therapy, ecotherapy. We can use any kind of psychotherapeutic modality in cannabis-assisted psychotherapy. The cannabis just speeds up the therapy process. We use a 6-session model to move patients through using cannabis-assisted psychotherapy. And I've seen more movement in 6 sessions with this than I have in 5 years of time talking to me on the couch. When we look at symptom relief of cannabis, it's a little bit different. And when I talk about symptom relief, I'm talking about anxiety, depression, hyperstartle, hyperarousal, dissociation, mood swings. And there we're going to use ratios of CBD and THC. So if you can think about in a naive cannabis user, the ratio of 20 to 1, using about 5 milligrams of CBD 3 times a day and 0.25 of THC 3 times a day. In a mild cannabis user, we're going to go up to an 8 to 1 ratio, using about 20 milligrams of CBD TID and 2.5 milligrams of THC TID. In moderate, we're going to jump up to a 2 to 1 ratio with 20 milligrams of CBD 3 times a day, but now 10 of THC 3 times a day. And then in a heavy user, we're going to go up to a 1 to 1 ratio with about 25 milligrams 3 times a day of both molecules. And this is for an average, let's say, 75 kilogram person. Maybe not so average weight for a Thai person, but for Americans, more average. I want to go through a couple case studies of patients of mine who were diagnosed with bipolar disorder, but then really found out that they had PTSD. And then when we effectively treated them with cannabis, they were able to get off of their medications. This gentleman was treated for 30 years with lithium. And he was very stable with lithium for all those years. However, when he came to me, he had a severe generalized tremor. We slowly took him off lithium, took a better history, really realizing he had PTSD. Over time with cannabis, using both CBD and THC, his mood stayed stable, and his tremors were able to totally resolve. The take-home points of this are that the symptoms of PTSD can be similar to other psychotic, mood, or anxiety disorders. PTSD can be commonly diagnosed as bipolar. And I think that not challenging this misdiagnosis can be harmful for the patient. So we must do a better job at treating our patients and taking careful histories. I also want to talk about using inhaled cannabis for breakthrough symptoms. For panic attacks or major depressive episodes or mood swings, someone might want to smoke cannabis. Taking the oral doses are really helpful for stabilizing someone, but people are going to have spikes in their symptoms, and that's what smoking cannabis can be helpful for. We have to think about why doctors aren't prescribing it. Medical schools aren't teaching it, and neither are residences and fellowships are not teaching it either. So we need to get beyond this. I hope medical providers now feel a little more comfortable recognizing and diagnosing PTSD, starting treatment as PTSD for PTSD, maybe instead of some other medications like SSRIs, and also how to help patients find the right dose. I would now like to open it up for any questions. Do you guys have any questions? I think we have time for a couple.
Mr. Braunstein,
Please hold on for a
here is
second.
question from
We
the
will give you a
audience.
signal again to continue
Have you ever
to
had
answer,
a
okay?
patient who has refused cannabis
Yes, of
treatment?
course.
Because
Okay, please wait
here
for a
in
moment.
Thailand, there's still a negative perception about cannabis. Mr. Braunstein, here's a question from the audience. Have you ever had a patient who has refused cannabis treatment? Because here in Thailand, there's still a negative perception about cannabis. Have you ever had a patient who has refused cannabis treatment? Because here in Thailand, there's still a negative perception about cannabis.
Okay, please answer the question.
So usually patients come to me requesting cannabis. So I would have to say no to that.
Okay, please answer the question.
So my specialty is prescribing cannabis. So I only see patients who are coming to me specifically referred for that, if that makes sense. I've seen an increase in patients' acceptance of cannabis. So the difference that I've seen is the wide array of patients who now seek this out. So elderly people who formerly wouldn't have thought of this are now seeking it. And I'm seeing children more. So parents bringing their children more in for this medicine. So over the past 10 years or 20 years in Colorado, as cannabis has been medically legal, I've seen a gradual shift in my local society's perception of cannabis. So while cannabis in Thailand might now be less accepted, as it grows and people talk with one another about it and see how helpful it is, acceptance will happen. Not overnight, but over years. But you will see it happen in Thailand.